doing?
I'm doing good. How are you doing today?
I'm doing good. It looks like before we get started, I looked at your x-rays and your pocket depths when we probed, and it looks like you have some signs of periodontal disease. So instead of doing a regular cleaning, we have to do something called a deep cleaning or a scaling and root planing. Is that okay?
So it's still cleaning, right?
It is. We'll just go a lot deeper. We'll have to get you numb. Yeah.
For a cleaning?
Yeah.
I don't know. Does insurance cover that?
No, and we can't really base your needs off insurance. We have to base it off like the signs that we're seeing, like the bleeding and the deep numbers that we talked about.
I just don't know if I want to go through with that if insurance isn't going to cover it. I mean, what if I don't do it?
If we don't do the deep cleaning, your bone loss is going to get worse and worse over time, and eventually you could end up losing those teeth. Also, legally, now that the doctor has diagnosed you with periodontal disease, it means we have to do that deep cleaning, and it could just be neglect if we're only doing a regular cleaning for someone who needs more.
So you're telling me I got to pay for a cleaning that isn't covered by insurance? No, I'm not paying for a cleaning. That should be free. Just go get the doctor.
Okay.
Hi, Mr. Poe and Dr. Patel. I heard you have some
Finally,
questions.
someone that knows what they're talking about.
What happened? Talk to me.
Well, she's saying that I need a deep cleaning, whatever that is, but that insurance isn't going to pay for it.
Okay.
And I'm just not doing that. I'm not paying $1 million for a cleaning.
Okay. I'm sure she already showed you the x-rays, but I'll show you once again if you want to turn around and look at the computer. So these are your teeth, and if you can see, the bone level should be about here, and it's already all the way up there. And then there's some like hardened plaque there too, which is called calculus. So now if we do a regular cleaning, that's not going to treat the active infection that's going on.
So you're saying if I don't get it, it'll get worse?
It will get worse, and I'm sure Caitlin already explained to you that what happens when it gets worse. And so legally and ethically, we can't provide you with just a regular cleaning when you've been diagnosed with periodontal disease, because legally we can't do that, and then ethically that would be neglect on our side as well.
The deep cleaning is kind of needed to remove all of that bacteria from under your gums, kind of where the bone is decreasing, so that way it'll be able to heal.
This can be a lot to take in, and this wasn't what you were expecting to come in today and hear, but there are definitely financing options that we can discuss. We can break up the SRPs into different quadrants so you're not paying everything at once. We can discuss payment plans, or we can even go outside and discuss with our financial advisor some different things that we could do for you.
So then what happens if I don't get it at all?
So what's going to happen if you don't get the SRPs? You remember that bone levels that I showed you on the x-ray?
Yeah.
They're going to keep getting worse, and that can eventually lead to tooth loss. Now, if you choose not to do the SRPs, we completely understand. We'll document that in the chart. It is your choice about what treatment you want to get, but it is our responsibility to explain to you what's going to happen if you don't.
Okay. Well, thank you for explaining. But I'm going to go talk to my wife about it and get back to you.
Okay, that's completely fine. We are both here to answer any questions that you have. You can always call the office, come back in. We're always here to help you, okay?
All right, thanks.
Yeah, of course.